Welcome to Open Enrollment for Roberts Publishing Group. This is a summary guide to your employee benefits effective May 1st, 2017. So I'm sure you're wondering what has changed for this year's plan year. The good news is the medical plans will remain the same, with Roberts Publishing Group covering the cost of the employee-only premium on the HSA plan. Dental and vision plans will remain with Emeritus. You will still be able to utilize Teladoc. If you are an employee that is on the medical plan, you and your dependents can save the cost of a doctor's visit, along with saving you time and energy. The disability and life insurance plans will remain the same with Dearborn and Lincoln. The main change for this year is how you will make your elections. We have a new enrollment system called Benefits in Hand. Open enrollment begins April 7th and closes April 14th. We have a new, easy-to-use online enrollment system called Benefits in Hand. The instructions for logging in were on a page that came with your benefit booklet. All employees eligible for benefits must log in and either elect or decline each coverage. This website can be accessed from your work or home, allowing spouses easy access to the information. Before you start, be sure you have your dependents' personal information, Social Security numbers, and birth dates so you can enroll them as well. And if you get stuck or you do not feel comfortable making the elections online, feel free to call the Employee Response Center at Higginbotham, and the ladies there will be glad to walk through the system with you and ask you the questions and reply to the website. You can also send an email to help@higginbotham.net. Again, the instructions for logging in were on a separate piece of paper that came with your benefit booklet. Open enrollment. The elections you make during open enrollment will go into effect May 1st and will remain in effect until April 30th, 2018. As soon as you make your elections on the Benefits in Hand website, once we get to May 1st, those elections are locked in for a year. The only way you can make a change to your elections would be if you had a life event during the course of the year that would allow you to make those changes for your household. A list of those life events is listed here, such as marriage, divorce, having a new baby. The change in your spouse's employment does allow for a qualifying event for you and your household. So if your spouse loses employment and you need to move that spouse or your children to the Roberts Publishing plans, that is a qualifying event. Medical plan comparison. As I said on the first slide, the plans that are being offered through Roberts Publishing have not changed. You have 3 plans this year. Again, the HSA plan has been offered for several years. I'll go through each plan and explain the high points. Your annual deductible for the HSA plan is a $5,000 individual deductible, $10,000 for a family. The coinsurance on this plan is 100%, which means that once you meet that annual deductible, your maximum out-of-pocket has been met as well. On this plan, as you recall, there are no copays for your office visits or your prescription drugs. You will pay the contracted rate between that doctor, that provider, and Blue Cross Blue Shield. So when you go and see your doctor on this plan, more than likely you'll be paying around $100 for that visit. Your diagnostic procedures all go toward the deductible, along with your hospital care. So if you're put in the hospital on this plan, more than likely you will be out of pocket $5,000. The prescription drugs, if you haven't been on a plan like this, has higher rates than copays, but every time you buy a prescription or go to the doctor on this plan, all those expenses are applied toward the annual deductible and out of pocket. So once you hit that $5,000 limit, everything is covered at 100%. On the PPO MMB4 plan, you do have copays. It also has a $5,000 annual deductible, and it's a 70% plan. So once you hit that annual deductible of $5,000, the insurance company will cover 70% of your expenses, and you will cover 30%, with that additional difference having a cap of $600. So if you're put in the hospital on this plan, you'll be paying $5,600 for an individual. The plan does have copays for either primary care or specialist at $40 a visit. Your urgent care cost on this plan is $65. I always try to explain to members that when you are looking at going to an urgent care, make sure you've done your homework ahead of time and find an urgent care facility in the Blue Cross Blue Shield network. As on all plans, the preventive care coverage is covered at 100%. That's part of the Affordable Care Act, pushing us toward getting our preventive care annually in order to catch any sort of disorders early on that we can treat early on and not have higher costs. If you're looking at doing any outpatient procedures on this plan, you'll be paying the cost of that procedure up to the deductible plus 30% of the coinsurance. That's the same benefit on your hospital care. Although the emergency room is a $100 copay, and you would pay 30% coinsurance if you went to the emergency room. With that cost being more expensive than urgent care, we do try to steer employees toward an urgent care facility before going to the emergency room. But I always say, if you're having a true emergency, get to the emergency room as soon as possible. Your prescription drugs have a $1,000 out-of-pocket limit, meaning you're capped at $1,000 for your copays on your drugs for the year. And as you can see, this year there's a little change. There are 2 different copays for your drugs, and that is attributed to the fact that Blue Cross Blue Shield has divided their pharmacies into a preferred pharmacy and a non-preferred pharmacy. If you go to a preferred pharmacy, examples of preferred pharmacies are Walgreens, Walmart, H-E-B, so that you would get a lower copay on your prescription. You still have the ability to go to other pharmacies, but you would pay a higher copay. And as a reminder, CVS is no longer in network with Blue Cross Blue Shield, so you will not be able to fill a prescription at CVS on these plans. You can always do mail order for your drugs that are a maintenance drug. They will come directly to your home, and you don't have to worry about remembering to go pick them up at the pharmacy. Now, the final plan is what we call the buy-up plan. It's a $1,000 deductible, $3,000 for a family. This plan, because of the lower deductible, does cost more. The coinsurance is 80%, which means once you hit that $1,000 deductible, the insurance company will pay 80% of your expenses, and you would be responsible for 20%, with a $4,000 cap on all of your out-of-pocket. This plan has lower copays, $25 for a specialist and $25 for primary care. Again, preventive care covered at 100%, and because this is a buy-up plan, you would have a $50 urgent care cost. Because the coinsurance is 80%, if you were to have diagnostic procedures, once again, you'd be paying the cost of that procedure up to the deductible plus 20%. And then the emergency room cost on this plan is $100 plus that 20% coinsurance. And as you can see for the prescription drugs, they are comparable to the other plan with the higher copays being less expensive. If you are on the HSA plan, you all have had this plan for quite a while, a plan like it. You are also able to pull money out of your paycheck and put those funds into a health savings account. You do that through Benefit Wallet. So there are some rules that the IRS says for having a health savings account. Number one is you have to be on that high deductible health plan. That's the plan that has no copays. You cannot be double covered, meaning you cannot be on someone else's plan, including Medicare, and you can't be claimed as a dependent on someone else's tax return. The maximum contributions for 2017 is $3,400 if you elect this plan as a single person. If you add any other family members to the plan, you can put aside up to $6,750 into that account to help cover the cost of your deductible and out-of-pocket. If you're over 55, you can add another $1,000. Now these funds are different than a flexible spending account because you do not lose these funds from year to year. They roll over from year to year so that you can build up this account to help cover the cost of your deductible every year. You can make election changes to this plan from month to month and change that because your contributions are through a payroll deduction and are pre-taxed. It saves you dollars on the funds that you use toward paying your medical expenses. So the one thing I always want to make sure everyone understands when you're putting money into a health savings account is the only thing you can use these funds for are eligible medical expenses. That's medical, dental, and vision. You are able to use those funds on your tax dependents, meaning children that you are declaring on your tax return, even if they are not on the plan with you. So if you use these funds for expenses that are not medical expenses, medical, dental, or vision, you are subject to a 20% penalty with the IRS, and you would have to pay the taxes on those funds that you use. Your expenses that you take out of that account must be incurred after the account is established. You can't go back to prior years. And distributions can be used for any expenses going forward. So your decision on a health savings account is how much do you want to contribute to the account and what expenses do you actually want to pay for with the account, because you don't have to use the account to pay for your prescriptions or doctor's visits. If you want to continue to save up those expenses into this account so that when you have a large expense, you have those funds there to help cover that, that is perfectly fine. That is up to you and your discretion. You do need to make sure and save all your receipts. I always suggest this so that you have the documentation, if you were to get audited by the IRS, to verify that you use these funds for medical, dental, or vision expenses. So I explained the health savings account as a way to pull pre-tax dollars out of your paycheck if you're on the HSA plan. If you elect one of the PPO plans, you also have the ability to pull pre-tax dollars out of your paycheck, have them deposited into your flexible spending account. The flexible spending account is not quite as flexible as the HSA. This plan, you elect a flat amount for the whole year. The deductions are spread out across the whole year. So you have to be conservative and make sure that you elect an amount that you know you will spend, because on this plan you do not get to roll over the funds. If you do not use those funds by the end of the plan year, you will lose those funds. You have the ability to have a medical flexible spending account and a dependent care flexible spending account for daycare and adult care. You will get a separate debit card for the flexible spending account that will allow you to pick up your prescriptions. You have a website specifically for the flexible spending account, and you can view balances and find claims forms. In addition to the medical plans offered to you, Roberts Publishing has put in a health reimbursement account benefit in order to help you with the cost of your high deductible on either the RMH3, which is the HSA plan, or the RMB4. You're responsible for the first $3,000 of that $5,000 deductible, and then the HRA will reimburse you up to the last $2,000 of that deductible for you and one of your dependents. You must submit an EOB, which is the explanation of benefits that Blue Cross Blue Shield will send you when you have claims, that shows the amount applied to your deductible to be reimbursed, along with a claim form. You must file that claim within 90 days of the plan expiration in order to receive that reimbursement. HR in your newspaper location will have the form, and then all you have to do is email it or fax it to me. Which medical plan is best for me and my family? I get this question a lot during open enrollment. The first question I always look at when I'm making my elections for open enrollment is how much will I pay if myself or family member must be admitted to the hospital? The answer to that question is what is the out-of-pocket for each of the plans. That's one determining factor that I look at. How often do you see a doctor? If you're one of those people who hardly ever sees a doctor because you're rarely sick, all you need to do is have your preventive care visits during the year, the HSA plan might be the best for you. What about ongoing medication? If you're taking a maintenance medication each month and it's expensive and you'd rather have a copay, then the PPO plan may be the plan for you. How likely are you to have services that are applied to your deductible? If you foresee you will be having surgery in the upcoming year, then it's possible you need to be looking at that deductible and that out-of-pocket to see which is less expensive for you. And of course, the cost of the plan plays into all of these questions as well. If you're looking for information to help save you on the health care during the year, I've listed several different websites that can help you in saving money on your prescriptions. GoodRx gets lots of good reviews. Also, a couple of reminders. You are required, due to health care reform, to have coverage each year for yourself and your family members. You can always go to healthcare.gov to look at the marketplace plans. One thing I need to point out is because Roberts Publishing offers you plans at an affordable cost, you would not be able to be approved for a subsidy. Also, as part of healthcare reform, Roberts Publishing does offer an SBC, which is Summary of Benefit Coverage, for you to review. It is a summary of your health care provided by Blue Cross Blue Shield, and it is on the Benefits in Hand website. I am hoping that you all will take advantage of the Teladoc benefit that Roberts Publishing is offering to you and your family. You have the ability to access a doctor 24/7 for you and your family members if you are on the medical plan. This not only saves you time, but it saves you money because there is no expense to accessing this benefit to you as an employee. These services allow you to call a doctor from home or work and to receive a medical consultation and then receive a prescription that you could pick up at your convenience without having to leave the office, go to the ER to see a doctor in person. These services are listed here, some of the top diagnoses: sinus problems, urinary tract infection, pink eye, bronchitis, upper respiratory infection. So these diagnoses, you call a doctor, give them your information, and they are able to, like I said, call your pharmacy, so that if you did this during the day and you felt a sinus infection coming on, called your doctor in the middle of the day, pick up that prescription on the way home, and by the next morning be feeling well enough to go to work and not have to miss any work. The one thing I like to make sure everyone does ahead of time is to call Teladoc to register, because they need to get your health benefit information before they can prescribe anything for you. So it's always good to do that ahead of time before you have that screaming baby in the middle of the night, or you wake up with something in the middle of the night and have to give them your medical information prior to actually being able to talk to a physician. We find this benefit is highly used and a great benefit to all sorts of different employee groups. Your dental plan is with Emeritus. I always want to make sure to mention that you need to make sure and use a dentist that is in the network for Emeritus. If you don't, you still have coverage, but you do have the issue of a dentist balance billing you if they are not in the network. So your maximum benefit is $1,000. You have to fulfill a deductible of $50 for yourself, $150 for maximum for the family. Preventive care is covered at 100%. Your basic services are covered at 80%, and your major services at 50%. Orthodontia is available to children under the age of 19 at a 50% cost, with the maximum that Emeritus would pay out on those procedures of $1,000. If you did not enroll in this plan when it was first offered to you as a new employee or at open enrollment last year, you will not have the benefit of the full plan for 12 months. Vision plan is with Emeritus as well. This again, you need to make sure to get the full effect of the benefits to use the VSP Choice Network. Your examination, as long as you're with a VSP provider, is $10. Your lenses are $25 copay for single, bifocal, or trifocal vision. You'll have a $130 allowance for your frames. And then there's some also additional cost if you add different options to your lenses. Contact lenses have a up to $130 allowance. If you are deemed medically necessary to have contacts, they are paid in full, and your fit and follow-up for those contacts is $60. Your laser correction has a 15% off retail price for specific providers. And then the frequency of these benefits is for your exams. You can go once a year. For your lenses, once a year. And then you have a frame allowance every 24 months. Again, be sure to use an in-network provider, and always make sure before you purchase your glasses that you understand exactly how much the glasses cost with all the benefits being applied through VSP's network. Voluntary short-term disability is what I refer to as paycheck insurance. This benefit pays you in the event of you becoming sick or having an accident that keeps you from going to work based on a physician saying that you're unable to work. It pays a weekly benefit. You can work part-time and accept limited duties and still maybe qualify for the benefit. So the elimination period, meaning you would not be eligible for the benefit if you had an accident after day 1, and if you had a sickness after day 8. You would get 60% of your weekly salary, and your maximum benefit would be $1,000 per week based on that 60% of salary. And this benefit does have a maximum period of 13 weeks. If you did not enroll in this plan when it was first offered to you, it's possible you would have a condition that would be considered pre-existing, and so that benefit would not be covered for the first 12 months that you would be on the plan. Long-term disability is your financial income protection if you have been unable to work due to injury or sickness for more than 90 days. The short-term disability is a voluntary plan that you can elect for yourself and pay for yourself, whereas the long-term disability cost is covered by Roberts Publishing. So once your doctor has deemed you unable to work for a 90-day period of time, you would then be eligible to file a claim to receive 60% of your pre-disability pay. The maximum would be $5,000 a month, and the continued period would be the later of age 65 or the Social Security normal retirement age. And there is a pre-existing condition on this plan of 312. As a full-time employee of Roberts Publishing Group, you are covered on a life insurance plan in the amount of $25,000. In the event your death is due to an accident, the amount doubles to $50,000 because we have accident, death, and dismemberment as part of the plan. This benefit is for all full-time employees, regardless of whether you take any other benefits or not. The benefit does reduce to 65% at age 65 and to 50% at age 70. Any beneficiary that you list needs to be over the age of 18 in order to receive the funds. If they're under the age of 18, those funds would be put into a trust until they turn age 18. You do have a conversion benefit on this to convert this plan to an individual plan if you were to terminate employment. It also has an accelerated life benefit, which allows an employee to draw down on that $25,000 of the fund if you're diagnosed with a non-curable disease. And of course, that amount would then be deducted from the benefit once you pass away. In addition to the group life insurance plan that Roberts Publishing offers you, you can purchase additional life insurance through Dearborn National as well to cover yourself and your family members. As an employee, you can elect up to $300,000 in increments of $10,000. Your spouse can elect 100% of that amount that you elect for yourself in increments of $10,000, and you can cover your child for up to $10,000 from the age of 14 days to 26. If your child is a newborn, they would be covered for $1,000 up to their 14th day. Guarantee issue is the amount of coverage you can elect when the plan is first offered to you without having any medical underwriting. For an employee, the maximum is $150,000, and for your spouse, it's $50,000. If you did not elect the life coverage in the past when it was first offered to you, you'll be required to answer medical questions in order to elect the coverage or to increase the coverage so that you can be approved for the plan. Remember, open enrollment begins April 7th and will end on April 14th. Don't forget to log in and make your elections, whether you're waiving or electing. In order to get the group life insurance and group long-term disability, you will need to make your elections. Call the Employee Response Center if you have any questions in being able to log in or on the benefits. Thank you.